Thanks for everyone for coming here this morning. And yes, I wanted to say that I think the first step in my cancellation as an academic was when I refused £350,000 to be taken from the NHS that they tried to offer me to promote messaging to make young people get the jabs. And I said, no, I'm not doing it. So my first slide here is, as you can see, I've got lots of examples. This is from NHS Lanarkshire, who were the people who tried to give me that money. Stop biding your time and get testing. And it actually says there, there's a whole video about how we should be tested. So I'm going to take you on sort of a little bit of a overall sort of in order, but this is the first slide. This was when I really was tired. 17th of July, 2021, I went to Silverbird Shopping Centre in Glasgow for some things at Boots and some things at Tesco. And remember these, that's why all my slides are red, all the fear. I think of red being the color of the fear and the panic and the red arrows and all of the intensity that was surrounding this whole situation. Stand here, turn this way, turn around this way, don't do this, don't do that. All these directions that we were supposed to follow. And it was absolutely ridiculous. And I was just sick by this whole situation. So let's go back to 1918, flu pandemic. Wear a mask. You should willingly cooperate wearing a mask and not necessitate the passage of an ordinance which will make the wearing of a mask compulsory. So this says, well, did it happen? Did it flatten the curve? Yes, no. Well, there were people that were protesting even back then. And, so this has a history of going on. Did anyone ever watch the film Outbreak, 1995? There was a monkey, apparently, in this film, predictive programming, right, saying that this was spreading quickly from this monkey that was being taken from California to California from Africa and carrying a deadly virus. The greatest medical crisis in the world is about to happen. Try to remain calm. That was from the synopsis of the video. Does this sound familiar yet? 2010, Mindspace by the Behavioural Insights team for the UK government. This is where we start to see the nudging and the behavioral psychology, the applied psychology, as my boss, Brian Garish, likes to talk about applied behavioral psychology, right? The key point is that government is always shaping behavior, often as in nudges. This is framed in terms of the choices government offers. However, Mindspace shows that it is not just choices that affect behavior. A whole range of factors in the environment affect behavior without any choices taking place. So you don't really have a choice. Contagion, 2011. Don't talk to anyone. Don't touch anyone. Nothing spreads like fear. So I was watching this just a few days ago. They had all of it. Masks, hand sanitizers, panic buying of groceries. A Chinese market suggested as the origin. The accusation of releasing a biological weapon. Spacesuit protection for health workers. Something called forsythia as the cure. According to the conspiracy theorist, that's me, right? Nightingale hospitals and arenas, don't let anyone in the house, don't touch anything, mass graves with no services allowed, no vaccine. Social distancing was actually used as a term in this film. So it was all there. This was Matt Damon walking through a grocery store with all the shelves empty. he wasn't supposed to wear a mask, apparently, because they decided that for whatever reason, Matt Damon was immune. I didn't write the film. There he is again. So there's some links here you can look at later. If we can make these links available, possibly. The opening ceremony of London 2012, the dancing nurses. Does anyone remember this? If you can go back and look at this, take a look at it if you haven't seen it. Dancing NHS nurses with wearing pandemic gear. 18th October 2019, Event 201, New York. A global pandemic exercise, co-sponsored by the Johns Hopkins Center for Health Security, the World Economic Forum, and the Bill and Melinda Gates Foundation. The next severe pandemic will not only cause great illness and loss of life, but could also trigger major cascading economic and societal consequences that could contribute greatly to global impact and suffering. This is directly from the documentation. It simulated, quote, an outbreak of a novel zoonotic coronavirus transmitted from bats to pigs to people that eventually becomes efficiently transmissible from person to person, leading to a severe pandemic. Some of the recommendations included governments, international organizations, and businesses should plan for how essential corporate capabilities will be utilized during a large-scale pandemic. And it goes on into countries, organizations, how we should all be working together to get all the supplies out, all of these countermeasures that we'll be talking about throughout the day. How do we get all the PPE out? How do we get mass vaccination rollouts happening? So these are all just a list of the recommendations with all of this corporate speak in them. So this was something I took at my former employer, the University of Strathclyde, where I was working at the time, on the 5th of January 2020. If you have been to Wuhan, China in the last 14 days, so these signs were posted in the university both in English and in Chinese. 30th of January 2020, falling flat on your face in China was a thing at the time, right? The caption says, officials stand near an elderly man who collapsed and died on the street in a hospital in Wuhan. And you can see the guys in the suits just like looking at the director, okay, where do we go next, right? So Richard mentioned this earlier, 19th of March 2020, COVID was no longer considered to be a high consequence infectious disease in the UK. 22nd of March 2020, SPY B, which was part of the SAGE behavioral team that gave official evidence to the UK government, options for increasing adherence to social distancing measures. To be effective, this must also empower people by making clear the actions they can take to reduce the threat. A substantial number of people still do not feel sufficiently personally threatened. So we're increasing the threat, letting people know there are threats. Everyone remember this? 23rd of March, 2020, you must stay at home, right? We all remember that. Also, on the 23rd of March, 2020, the hand washing campaign supported by a behavioral insights team who's responsible for all these nudges, saying this is how you should wash your hands, and so we start to see how the messaging is happening. We must follow exactly as identified, a bright, clear design with minimal text and an emphasis on the step-by-step procedure. The addition of the coronavirus branding will likely make it even more effective at attracting people's attention. 2nd of April 2020 on the BBC. In Italy, the death rate from COVID is more than 10 times greater than Germany. Why does the death rate vary so much internationally? So all the memes start coming out on the internet, right? The quarantine wardrobe, the messy hair, everyone's staying in their pajamas. So my birthday is 28th of March, so March 2020, March girls, they're talking about our quarantine birthdays. Make a mask out of a bra, they said. So we have the little girl with the tiny bra that just covers her nose and mask. Then we have the girl like me on the bottom where the bra is like this big, right? 6th of May, 2020, the dancing nurses. Let's see if this video works. Right. There are still some people who don't know how to put on their masks. 9th of June 2020, that was the caption for that one. It's actually a better place for them. July 2020, World Economic Forum, COVID-19, the Great Reset. One path will take us to a better world, more inclusive, more equitable, and more respectful of Mother Nature. The other will take us to a world that resembles the one we just left behind. Worse and constantly dogged by nasty surprises, we must therefore get it right. 2020, this is where we see the origin of social distancing, which actually came from a Marxist academic written decades ago, talking about how basically the idea of a social distance, it increases the power dynamics that the people in power stay distanced away from the rest of us. And this is between us, there is contained in the mental distance of fear. 11th May 2021, your best sexual partner is yourself. According to the BBC, the latest lockdown easing means new guidance on having sex. In England and Scotland, you'll be able to meet indoors and stay in another person's household overnight from Monday. Well, that's very nice of them. The rules means that between friends are also being relaxed, which means you can now have sex with someone outside of your household or support bubble. Lovely. 16th of May 2021, the publication of a book called A State of Fear by Laura Dodsworth. I highly recommend taking a look at this book. Fear of death, fear of losing our jobs, our democracy, our human connections, our health, and our minds. also about how the government weaponized our fear against us, supposedly in our best interests, until we were the most frightened country in Europe. 10th of June 2021, Professor Susan Michie, who was on SPY-B, said masks should stay forever in 2021. And then in 2022, she got a major job in charge of psychology and behavioral change at the World Health Organization. What a promotion. 31st of July 2021, I took this photo myself outside of Glasgow Central Mosque. The sign said vaccination centre. Someone had written in with a marker above it the word experimental. 4th of September 2021, children set to be jabbed from early next week. Nicola Sturgeon said last week she was eager to deliver doses to younger people as quickly as we possibly can, and Hamza Yusuf said the review would be carried out rapidly. 26th of October 2021 in Dundee, I was there. I took this photo, pick up and drop off only from mass vaccination center. Right? 13th of November 2021, NHS Lanarkshire, the people who offered me money, watching Strictly tonight. Why not take a lateral flow test during one of the pre-dance VTs? 4th of 5th December 2021, UK red alert. Omicron's ability to hit the double jabbed. 18th of January 2022, NHS, unvaccinated people who get COVID are 8 times more likely to be hospitalized than those who have had both doses of the vaccine and a booster. Get boosted now. 17th of February 2022, Manchester Weekly News. Don't miss out on getting your jab. Also, get boosted now. Again, get boosted now. Safe for pregnant women, get boosted now. 31st of January 2025. This is just a few days ago. The fear continues. This is from the States. 5 years since COVID declared public health emergency in the US, still killing thousands of people. And I would like to mention the 9th of March 2025 is the COVID Day of Reflection, which is now part of UK policy. My story basically is that was me. That was the only mask I ever really wore when I was really, really forced to. And it says, enjoy the silence, because I'm sure people did once I put the mask on. But the personal story that I wanted to share at this point is my mother died in December of 2021. She went into the hospital for some bruising. When she fell, she was in an assisted care home. It's hard to say. The next thing I heard is that she was on a ventilator, and a few days later, she was gone. I didn't have any say in the matter. I'm an only child. My father had already passed away. I was not able to go back to America to help, to save, to even attend a funeral because I was not jabbed and I was not tested, and I refused to test because I knew that's what she would have wanted from me. But it was one of the hardest things I've ever been through. And I just want to say that because this is one of the things that motivates me to do what I'm doing now, and also because I want to hear from the rest of you today who are willing to speak out, who had similar tragedies happen to them. So thank you all very much for your time.